everyone. I'm going to be doing a little presentation today about visualizing Oregon's maternal care access. My name is Meghan Bausone. I am a systems designer and doctoral candidate at the NC State University, researching design innovation for rural maternal health access. I live in Portland, Oregon. It's okay, it's not a war zone. Good. So I started volunteering in the spring of 2025 with the PDX Digital Core. It was like a short-term volunteer-run operation that focused on helping organizations in the community to get like a tech project up and running. We had over 100 volunteers and we worked on 6 different projects, and this was the last one that we brought in. If you have any questions about the PDX Digital Core or how to run your own digital core in your community, you can talk to Ron Bronson back there because he was the founder and organizer of the PDX Digital Core and also the keynote this morning. I worked on this project with a number of people. I was the project manager, and you'll note I didn't do any of the development stuff, so don't ask me about how that worked. We also have Matthew Cole in the audience over there who did some of the development work. And shout out to Nat, who's the organizer here, who helped as a GIS subject matter expert. And again, Ron Bronson. Oregon State University, we worked with Melissa Cheney and Marit Boberg, who are the founders and organizers at Uplift Lab, which is dedicated to reproductive justice and reproductive equity and access. Also, Melissa Cheney is a community midwife, and so I've been working with her outside of in this project. So why do we need to map maternal health resources? In case you didn't know, the United States has the highest maternal mortality rate among high-income nations. This is in 2024. It's significantly higher for Black women in the United States, but higher overall than like many of our global colleagues with similar income. Pregnancy-related mortality ratios are over 50% higher in rural areas than in large urban areas. And we have in the United States a maternal care desert crisis where in a lot of rural areas, even in some urban areas, there's a lack of maternal care. And that's across the board. So like if you live in one of these red areas, you don't have access to any OB or maternal health resources at all. So factors that are influencing like what's going on. In Oregon specifically, Medicaid in Oregon only reimburses about 56 cents per every dollar of patients' care, and that's a problem because over half of the births in Oregon are funded by Medicaid, and it's even higher in rural communities. So you'll have very large populations of people who are experiencing low rates of coverage or high rates of Medicaid coverage, and then the hospitals aren't being reimbursed for that. And they're already on really thin margins. So there's a bunch of hospitals that are at risk of closure. So during the 5-week sprint, we made a simple interactive map for the Uplift Lab website. We mapped hospital and birth center locations throughout Oregon using publicly available data. And we built it just so that they could hand it off and use it again. We also added the ability to toggle on and off at-risk locations. So you can see the bigger map here with the legend. The home access midwives, we didn't have an opportunity to map that, but we wanted to look at that as a future opportunity for demonstrating how they could add further access. The goals to demonstrate the impacts of at-risk locations closing, to look at facilities that aren't currently offering labor and delivery services, but could potentially offer it to expand access, and then also to potentially identify levels of service, like, for example, level 4 regional perinatal health centers. They're actually the closest ones to Oregon are in Seattle, UW Medical Center and Seattle Children's Hospital. And then also Uplift Lab wanted to use this to fundraise for more opportunities to continue mapping other states and to just bring resources and attention to this. So a little demonstration here. This was an at-risk location when we were doing the project, a hospital in Lebanon. When we got rid of that location, you can see, I'll toggle it back, a lot of expanded low access area around that location. But on a happy note, so during that, the project, there was a lot of publicity about that location. There's a lot of protesting in that community about that being at risk. And then in August of 2025, following our project, their birthing center remained open. And I don't know if someone showed them our map, but I would like to think so. And so we had a little success there. And yeah, that's it. Thank you.